What is the role of corticosteroids in the metabolic management during cardiopulmonary bypass? A. To enhance glucose uptake by tissues. B. To suppress inflammation and reduce the stress response. C. To decrease potassium levels. D. To increase oxygen delivery to tissues. Answer: B. To suppress inflammation and reduce the stress response. Explanation: corticosteroids are sometimes used during CPB to modulate the inflammatory response and reduce the stress-induced release of catecholamines and cytokines. This can help mitigate the adverse effects of inflammation on metabolic processes and improve postoperative recovery. What is the most common electrolyte imbalance seen in patients undergoing cardiopulmonary bypass? A. Hypophosphatemia. B. Hypercalcemia. C. Hypokalemia. D. Hyponatremia. Answer: C. Hypokalemia. Explanation: hypokalemia is one of the most common electrolyte disturbances during CPB. The dilution of blood, shifts in potassium due to acid-base changes, and the use of diuretics can contribute to decreased potassium levels, leading to complications such as arrhythmias and muscle weakness. Monitoring and correcting potassium levels are essential during CPB. What is the significance of monitoring ionized calcium levels during cardiopulmonary bypass? A. It helps assess glucose metabolism. B. It aids in determining the degree of acid-base disturbance. C. It is essential for controlling coagulation and myocardial function. D. It ensures proper ventilation settings. Answer: C. It is essential for controlling coagulation and myocardial function. Explanation: ionized calcium plays a critical role in coagulation and myocardial function. During CPB, ionized calcium levels can be affected by hemodilution, the use of citrate in the circuit, and the administration of heparin. Monitoring calcium ensures that proper coagulation is maintained and helps prevent complications like bleeding or arrhythmias. What is the effect of cardiopulmonary bypass on liver function? A. It enhances liver function due to increased perfusion. B. It may impair liver function due to hemodilution and low perfusion. C. It has no effect on liver function. D. It improves detoxification processes. Answer: B. It may impair liver function due to hemodilution and low perfusion. Explanation: during CPB, the liver can experience decreased perfusion and oxygenation, which may impair its ability to metabolize toxins and produce proteins. Hemodilution can also affect liver function, leading to metabolic disturbances and delayed recovery of liver function postoperatively. Which metabolic disturbance is most likely to occur due to the use of a prolonged cardiopulmonary bypass? A. Hyperphosphatemia. B. Metabolic acidosis. C. Hyperglycemia. D. Respiratory acidosis. Answer: B. Metabolic acidosis. Explanation: prolonged CPB can cause a buildup of lactate due to anaerobic metabolism, leading to metabolic acidosis. This is further exacerbated by reduced tissue oxygenation and can be corrected with bicarbonate administration and improved oxygenation and perfusion during surgery. How does low systemic oxygenation during cardiopulmonary bypass affect metabolic control? A. It leads to the activation of anaerobic metabolism. B. It decreases glucose metabolism. C. It enhances ADP production. D. It reduces the formation of lactic acid. Answer: A. It leads to the activation of anaerobic metabolism. Explanation: low systemic oxygenation during CPB forces tissues to rely on anaerobic metabolism, which produces lactic acid as a byproduct. This can lead to metabolic acidosis, highlighting the importance of maintaining adequate oxygenation during bypass to prevent this disturbance. What is the main concern when using high-dose insulin during cardiopulmonary bypass? A. It can lead to hypoglycemia and impaired brain function. B. It causes hyperkalemia by shifting potassium into the cells. C. It can worsen metabolic acidosis. D. It leads to increased blood pressure. Answer: A. It can lead to hypoglycemia and impaired brain function. Explanation: while insulin is used to control hyperglycemia during CPB, high doses can result in hypoglycemia, which is particularly dangerous during surgery. Hypoglycemia can impair brain function, leading to confusion, seizures, or even coma if not managed properly. What is the significance of monitoring arterial blood gas, ABG, levels during cardiopulmonary bypass? A. To monitor glucose metabolism. B. To assess oxygenation and acid-base status. C. To control temperature. D. To adjust medication doses. Answer: B. To assess oxygenation and acid-base status. Explanation: ABG levels are critical during CPB as they provide information on oxygenation, carbon dioxide levels, and pH. Monitoring these values allows clinicians to assess whether the body is effectively oxygenating tissues and to correct any acid-base disturbances that could affect organ function. What effect does cardiopulmonary bypass have on renal function? A. It improves renal function by increasing renal perfusion. B. It has no impact on renal function. C. It can cause acute kidney injury due to decreased perfusion and ischemia. D. It increases glomerular filtration rate, GFR. Answer: C. It can cause acute kidney injury due to decreased perfusion and ischemia. Explanation: during CPB, renal perfusion is often reduced, and prolonged ischemia can result in acute kidney injury, AKI. The kidneys are sensitive to changes in blood flow and oxygenation, and insufficient perfusion during surgery can lead to impaired function, requiring close monitoring of renal biomarkers. What is the effect of cardiopulmonary bypass on protein metabolism? A. Increased protein synthesis due to high metabolic demand. B. Decreased protein synthesis and increased breakdown due to stress response. C. No significant effect on protein metabolism. D. Increased gluconeogenesis from amino acids. Answer: B. Decreased protein synthesis and increased breakdown due to stress response. Explanation: during CPB, the stress response induces the release of cortisol and other catabolic hormones, which lead to increased protein breakdown and decreased protein synthesis. This can result in muscle wasting and poor postoperative recovery if not managed properly.